Hello everybody again, my name's Claire. If you've been following my videos so far, then you'll know that I've been considering having an abdominoplasty. Today I actually went to see a surgeon about having the operation done, and I said in my last video that I would update once I'd had that appointment. I'm absolutely shattered, so if I seem a little bit out of it, I've been on the road for about 6 hours today, so that's why. But yeah, so I went to see Mrs. Cat, who was the surgeon that has previously operated on me before. Initially, like any other consultation that you'd have for any procedure, went through a previous medical history, which is really important before you're considering any kind of surgery, to make sure there's no problems that are going to complicate things or compromise your result. All happy with that, no problems there at all. Mrs. Cat discussed with me all the risks and things, potential risks of surgery. A lot of that's just general risks of surgery, like the risks of being under a general anaesthetic, you know, things like that, risks of infection, that kind of thing. So went through all that information with me, and then asked me what I wanted to gain from the surgery, really. And as I said in my previous video, you know, that's just to get rid of a lot of the loose skin that's in my abdominal area since I lost 6 stone in weight. So I obviously told her that that was the reason why I was just, you know, thinking about having the surgery done. And then she went on to discuss sort of the, you know, what she could give me, really. And discuss the procedure that she does. She does what's called a lipoabdominoplasty, which is basically a tummy tuck that also involves a little bit of liposuction just to give a better contour. And then she does a muscle repair, which ties any loose muscles together and things like that at the same time as well. So it's quite an in-depth surgery. She said that basically on a scale of 0 to 10 in terms of how hard going it is on the body, the breast surgery that I had done previously was like a 4, whereas the abdominoplasty is more like an 8. So that leaves me a little bit apprehensive as to what's to come, but you know, you can't get anything for nothing, so you have to accept that when you're having any kind of procedure done like this, and that's all part of the research process, so that's fine. She did a full examination of me to make sure she knew what she was dealing with. Obviously had a look at my tummy when I was stood up, when I was leaning over, when I was lying down, and sort of checked the tautness of my skin, or lack of tautness in my skin I should say. And basically what she said to me is, when she examined my muscles, that I do have a gap between the muscles down the middle, which she said is probably mainly from pregnancy than anything else, but it's actually not that bad. She said it wasn't really that significant, and that she would put a couple of sutures in it just to hold it together, but in actual fact I didn't need much of a muscle repair at all. She said that the tone and the definition that I've already got in my abdominal muscles is absolutely amazing, so that was quite a nice compliment to have, and that it will really help me in my recovery afterwards. She also said that I've got pretty much 0 fat in the area, so I'm not going to have any lipo at all, which she said is pretty much a first for her. That for most patients, they do need a little bit here and there, but she said she just doesn't want to suck any more fat out of that area to me, because she said I'm going to lose my shape, so she doesn't want to be doing any lipo. So it's just going to be a basic, simple tummy tuck in a lot of ways, very little muscle repair, and she said the problem that I've got is the skin. You know, I've got an awful lot of excess skin. Now, because of the amount of excess skin that I've got, I'm going to have a longer scar than most people would have. In a normal abdominoplasty, the scar is from hip bone to hip bone, quite low down. For me, it's probably going to go a little bit around the sides, so not round towards like at my back, but at least right round the edge, sort of towards my hips. And the reason for that is, like she showed me when she pulled a lot of the skin down, that if she doesn't take the scar that far, I'm going to end up with dog ears on the ends of my scar, like little bits of skin hanging over, which I'm not going to be happy with. It's not going to give a good aesthetic, so it's much better for her to take the scar that little bit further, which is still going to be hidden, you know, by any underwear or anything that I wear anyway, but it'll just give a better aesthetic for me. She also said that unfortunately for me, I've got quite a short body, which means that the skin from underneath my breasts down to sort of my belly button area is quite short, and normally what they do in a full abdominoplasty is to take away everything from the top of the belly button down towards a pubic bone. But in my case, she can't really do that, because I haven't got enough left over skin to fill the gap. So if she tried to do it, I could end up with a whole host of problems, things like skin necrosis and things like that, and the wound breaking down because it would be pulled way too tight. So what she's going to need to do is what they call an inverted T scar, which basically means that I'll have the hip bone to hip bone scar a little bit further, so that incision will go across the lower abdomen right along the sort of the pubic bone line, along the bikini line, but then I'll have a very small, about 1 inch vertical incision from sort of the middle of the pubic bone up a little bit. And again, that just needs to be done to pull everything together, and to get rid of any bits of skin that were around what would have been my belly button as it is now, and then I'll be given a whole new belly button and all that. So it does mean a little bit of extra scarring for me, but she has assured me that it will still be really, really low down. It'll still be covered by my underwear. So, you know, if that gives me a better result, then that's what I need. You know, I can't change my anatomy, so that's that. So that was quite good. So I was quite positive. It was quite positive, really. She said that because I'm not going to have much liposuction or no liposuction, not much of a muscle repair, my recovery will be a lot quicker than it would be if I needed a lot of work done. So that's good. She gave me some advice on some exercise that I can do. She said my muscles were really, really good anyway, and there wasn't really much else. There wasn't really much more improvement that I could do. But she did give me some leaflets with some quite thorough abdominal exercises, various different things that I can be doing and helping myself in the run-up to surgery, and the similar exercises to what you get post-op as well, so it's something to get used to. So they're very gentle, but it'll help me, so I'm prepared to do everything that I can to make sure that my recovery is as quick and easy as possible. She gave me some, you know, just general advice about the operation itself, that it, you know, for the first 2 weeks I'm going to be very hunched over, I'm going to be uncomfortable. Like I say, it's going to be more painful than the breast surgery was going to be, but the pain's managed in a different way. So like when you have breast surgery done, you come out of theatre and you're straight onto sort of oral pain relief. So you're starting off with your paracetamol, ibuprofen, things like that, and then you work your way up if you so need it. I'm not very good with oral medication. I get very, very sick on it. Even things like diclofenac and stuff can make me quite sick. So when I start going into the reams of tramadol and things like that, it makes me really, really ill. So when it comes to taking oral medication, I'm pretty much stuck to paracetamol really, unless I want to have the after effects of the vomiting afterwards, which I don't want to be vomiting when I've had a tummy tuck. But like I say, it's managed completely different. So what she does is, during the course of the operation, she puts a small catheter into the muscle layer, which is attached to like a pump, a morphine pump, and a mixture of morphine and local anaesthetic. So that helps to control the pain. So it just means that it anaesthetises that whole area. So you're not needing to take loads of oral or even IV, you know, strong painkillers. So you can keep your painkillers down to an absolute the oral painkillers down to an absolute minimum, which is perfect for me. And that runs for 2 days. You're in hospital for 2 days, 2 nights, to make sure that you know that you're recovering well, and to give you the chance to get all that local anaesthetic and things and that good pain relief for those first couple of days, which is when it's going to be its worst. So she gave me some, you know, realistic expectations really, that I am going to feel dog rough for the first couple of days at the very least, and the first couple of weeks are going to be quite tough, and I'm going to need a lot of support and help, which is pretty much what I expected. You know, when you know you're going to have your muscles tied together, a load of your skin cut off and put in the clinical waste bin, you know that it's not going to be straightforward running out the hospital doors 2 days later. So that's fine. At least you know when you know what to expect. You don't get a shock at the end of it. The cost of the procedure is going to be £5,777. It's a lot of money, but then when you consider that, it's a full package of care. So that includes with pre-op checks, that includes the surgery itself, it includes the cost you have paid to stay in hospital for 2 days, all the medication, the full team, the anaesthetist, all the staff, the nurses, drugs. It includes all the post-op checks as well, and it also includes the advice that I'll be getting from a physiotherapist in the post-op period as well, which is great because they offer that as part of the service to help to get you back to normal following the operation, which is great. So I think actually when you actually look at and break it down, it's money well spent, or it is in my opinion anyway. So it's all booked in. I'm booked in for the 15th of January 2014, so it's about 6 months away. So that gives me bags and bags and bags of time to prepare for it, both mentally, physically, financially, get myself in a position where I know that I'm, you know, absolutely ready for the operation. So I can enjoy my Christmas, and I've got a holiday and things like that booked beforehand, so I can sort of do all that first and then have the operation in January, and at least I'm not sort of worrying about trying to get out in the sun and things like that in the summertime, so, you know, because it'll be miserable British weather. That time, mind you, it's miserable now and it's July. I did say in my last update that I would now show you some before pictures, though, you know, pictures of what I look like now basically, and I will do that. So here's some pictures of my tummy as it is now. So some of you might be thinking, oh, actually, that's not that bad. But, you know, everyone's to their own, and to me, it's bad. To me, it's something that really affects me on a daily basis, and for me, it's worth paying the money and going through all the procedure to have it look a lot better. Some of you might be thinking, oh, I'm surprised it's as bad as that. If people who know me, you might be quite surprised that it does actually look like that under my clothes. And I guess that's the reason why I'm going for this. That's why I'm doing it. You know, I'm not going through all this for nothing. So whether you think it's worth it or not, it's a personal thing. Personally, I think it's worth it, or hope it's going to be worth it. You know, you never know what you're going to go through really, but hopefully it's going to be quite straightforward. You know, as long as I'm going into this with an open mind, and you know, I know what to expect. I know I'm going to have this scar. I know I'm going to have this extra little scar now. I know that it's going to go a lot further around the edges than I sort of perhaps initially thought. But all that horrible, creepy, loose stretch mark skin is going to be in the bin, and that sounds great to me. So yeah, I think that's pretty much everything that I can really say about the whole process today. I'm really happy that I'm going with Mrs. Cat. I did have a consultation with another surgeon a few months ago, and I would have quite happily booked with him. He was just as knowledgeable, just as professional. I felt just as safe in his hands really as I would have done with Mrs. Cat. But I think when you have a consultation with a surgeon, you either know or you don't. And you know, for me, I've had surgery with her before. I'm happy to have surgery with her again. There is also the issue that I did have my post-op check today as well from the breast surgery that I had, and there's still a slight little problem on my left breast, and while I'm under the anaesthetic, they're going to sort that out for me at the same time. So even more reason to go Mrs. Cat again really, because I just have the whole thing done at once. It's just loads easier. It's not going to be anything much. It's just a small dog ear at the bottom of the scar. That's all. It just needs excising, and that's it. Like I say, nothing major. It's not really going to make my recovery any worse or anything like that. It's just going to be quite straightforward. But yeah, it all gets done at the same time, and that's getting done for free. I'm not having to be in charge anymore for that, so that's great. But yeah, so look forward to January the 15th. I will update again probably in a couple of months' time when I've been given more information about pre-op and things like that. Unless anything else changes in the in-between time. But thank you very much for watching again. Like I say, I will keep it updated as and when anything changes, but it'll probably be the pre-op next. So, thank you very much for watching. Bye-bye.